The next section of her argument is entitled Equitable Access. Now, in this section, she is dealing with her opposition. She acknowledges her opposition, what her opposition is going to say, and she provides a concession, and she also provides rebuttal. So this is an important piece. At the beginning, she says, opponents of payments to living organ donors focus on several issues. See, right there, she's saying, okay, look, I know that there are people who are going to oppose this. So she acknowledges her opposition. And then she says, she talks about what one of these oppositions, one of these things are going to be. It says the immediate past president of the United Network for Organ Sharing, Francis Delmonico, suggests that kidney shortage is driven by societal failure to prevent preventable renal disease. So he's saying, okay, the reason why we have this shortage is not because there's not enough donors. He's saying we have the shortage because we aren't preventing diseases that could be prevented. And that's where the focus should be, is preventing the diseases in the first place. Now, Friedman responds to this by saying, I agree that we need to improve the quality of care to all members of society, which is, if you remember back, that is a concession. She's agreeing with her opposition. So she's saying, you're right. That's true. We should be giving better care to everyone. But then she replies with a however. I mean, it's perfect. It's a perfect concession. I agree, however. However, it seems unfair to penalize people who have already developed disease as a consequence of the flawed care they were powerless to improve, or to ask patients to wait for ideal medical care that seems unattainable. So what she's saying is, that's true, we need to focus on preventing these diseases. However, we still need to treat the people who have the diseases, regardless of if they could have been prevented or not. And this is very interesting. The next thing she says is this is particularly true for people who are economically or ethnically disadvantaged, among whom the rates of end-stage renal disease are disproportionately high. And so, again, she is appealing to her audience and their sense of fairness and how they want everyone to be treated equitably. The next thing she does is she makes a comparison, and she's going to compare what Francis Delmonico is saying, which she wants you to disagree with Francis Delmonico. So she's going to compare what he's saying to something she knows her audience will also disagree with. Remember I said you can make comparisons to things that you want them to agree with, to something they already agree with, or make a comparison to something that they will disagree with because it's something you want them to disagree with. Okay, here we go. So she says, if this approach was reasonable, people with sexually transmitted diseases and women carrying unwanted pregnancies ought to be denied the benefits of care because they have not taken appropriate precautions. There is little dignity in dying without access to medical treatment that is known to have a high likelihood of prolonging life. This is great. She's saying, okay, if we're going to follow your train of thought here, your principles of, well, it could have been prevented, so too bad. We need to focus on preventing it, not on curing it, not on treating it. So what she's saying is, okay, so that's the same thing as saying, well, this person got an STD, this person got gonorrhea or chlamydia or whatever it might be, and we're just going to say, you know what? Too bad. I'm sorry that you had this disease, but we're not going to treat you. You could have prevented it. You could have been more careful. And because you weren't, we're not going to help you. Or here's a woman who is pregnant, had an unwanted pregnancy, and they're like, you know what? You could have prevented being pregnant, so we're not going to help you. Her audience is going to be outraged. Her audience is the medical community. They're going to think this is ludicrous. And that's exactly what she wants. Because she can say, if you think this is ludicrous, if you disagree with this, then you need to disagree with what Delmonico was saying about renal disease, and she's made her point. Okay, now another thing is going on, and that is the next paragraph down, which says a compelling argument that money in exchange for an organ would exploit the most needy was countered by Anthony Monaco, a past president of the American Society of Transplant Surgeons. Monaco noted that developed societies have already become comfortable with the use of tangible recognition for personal self-sacrifice that is most likely to flow to the needy. If military service can be recognized with inducements such as paid education, enlistment, etc., 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 and he makes the comparison to military service, that military service really appeals to people of lower socioeconomic status because they get all of these, not only are they paid, but they get all of these also inducements. And he's saying that those are the same thing. Okay, she's using somebody who's credible. She's not using her own words. She's using Anthony Monaco, not to be confused with Francis Delmonico. I know they're kind of similar. But Anthony Monaco, she gives his credentials saying he's a past president of the American Society of Transplant Surgeons, so he has good credentials, and that he's making the comparison between paying people for their organs, saying, you know, yes, it will appeal to the most needy, but don't we already do that? Isn't that already accepted through things like military service? The comparison makes sense in some ways. Personally, if I were analyzing this, I would have an issue. Do you notice that my face keeps changing color? I just have to say, the light keeps changing outside because the clouds keep passing over the sun. And so see that? Now my face is changing. I know, it's just bothering me. Anyway, the point is that this comparison is not the strongest. I think there's going to be people in her audience who are not necessarily going to agree with this comparison. I think that up to this point, Friedman has been presenting a wonderful argument, textbook argument. And here she stumbles a little bit. This really isn't particularly strong. I don't think it's going to convince all of her audience. So this is probably the weakest part of her argument.